welcome the NSF staff, headed by the DG, Director General of the National Science Foundation, Dr. Sepalika Singha, and Additional Director, Dr. Shantasiri. Also, joining here with us today is the team from the Faculty of Medicine, University of Colombo. So, shall we start the session now? I guess we can start. Right. Okay. Right. Okay. Then, very good morning to all of you. So, as per the agenda of this joint webinar today, we are going to start it with a brief welcome and opening remarks, which would be delivered by Dr. Shantasiri, Additional Director of the National Science Foundation. Over to you, Dr. Shantasiri.
Thank you, Tilina. My voice can hear you, huh?
Yes, we can hear you.
Right. Good morning. And on behalf of the National Science Foundation and Director General, Dr. Sepalika Singha, and our Chairman, Professor Saman Senavira, I extend a warm welcome to our distinguished speaker, connecting online, Dr. Chatura Gunasekara. Warmly welcome, sir. And Professor Vajida Disanayaka, Dean, Faculty of Medicine, University of Colombo. I extend a warm welcome. And team from the medical faculty and also other participants who connected online. On behalf of the NSF, I extend a warm welcome. To start with few opening remarks, I want to highlight that one of the mandates of the National Science Foundation is to facilitate exchange of cutting-edge scientific information between Sri Lankan researchers, scientists, with the scientist and research community abroad, so that ultimately our innovation ecosystem will go propel towards the advancement. Accordingly, National Science Foundation is also now going on a transformational change. As you could see in the opening introductory video to the NSF, we have gone much towards in aligning with the government's digitization national initiative. NSF already has gone on digital platforms. We have several digital platforms to facilitate more our services to our customers and the relevant stakeholders. You could see a couple of such platforms like Science and Technology Management Information System, National Instrument Database, Global Digital Platform, and Sri Lanka Journal Online. Those are only a couple of key platforms. And one of the digital platform is the Global Digital Platform, where today's program align accordingly. As you see, to keep our mandate, we want to empower our R&D workforce, STI personnel with the cutting edge knowledge and know-how and show-how. In early time, it was through digital databases mainly through the journals, but through our NSF global digital platform, we have been able to connect our Sri Lankan expatriates leading in the industry as well as academia from around the globe to connect with our Sri Lankan researchers and the scientific community. That is how Dr. Chatura Gunasekara connected to our digital platform. So he's ready to transfer or empower you with his expertise knowledge. of course, Dr. Chatura this is the second knowledge transfer program. He conducted another, I think, latter part of last year. He conducted one knowledge transfer program on bioinformatics. Today will be the AI in the context of medical field in the context of AI. So, of course, apart from other than the journal databases and these live programs, there is a significant difference because journals and those black and white sources will only provide you that knowledge only. But this live kind of knowledge transfer program, I am sure our expatriate Sri Lankan, they are in abroad, but in heart, they are in the motherland. So they want to do something in return to the country. That is why Dr. Chatura and our other distinguished expatriate, they unconditionally, voluntarily, with their, I mean, I don't want to say that their time and the opportunity cost, but voluntarily they have come forward and readily shown their willingness to share their cutting edge knowledge. So, I greatly appreciate Dr. Chatura has come forward and willing to share his cutting edge knowledge. So, with that, then also I want to highlight, I am sure today this knowledge transfer program will be a key activity program for Sri Lankan context, because I need to say, as you all know, AI is invading each and every field, immaterial, medical, or industry, or a diverse spectrum. AI is even research management. Now AI is infused. So it is very important to empower our workforce. I presume not only the medical practitioners, but of course medical administrators, both as team should get empowered with AI, medical field with the AI context. Particularly, I'm not an expert, but as a layman, I see the power of AI in the medical field, particularly in the diagnostics, as the latest publications highlight, a paradigm shift to be done or made with the AI in the context of diagnostics. Of course, so data and the patient data will mine by the AI tool, so that it will help practitioners to identify early diagnosis or identify early symptoms. So very, very important, so that our workforce will be ready with the emerging technology. So without further ado, those are the key opening remarks I want to highlight, and I want to last but not least, I want to highlight that please actively engage with this program. And I am sure if anyone beyond this program, if anyone need further clarification in any initiative in whatever the possible way, I am sure our resource person will support in furtherance of any kind of any initiative in whatever his capacity possible. So with that remarks, I will stop here, and I appreciate again Dr. Chatura's contribution in this endeavor. And I'm sure our Director General, Dr. Sepalika, also on board, maybe halfway through. I'm sure she will be throughout this program and observe whatever the proceedings. And thank you very much, and I will stop here.
Thank you, Dr. Shantasiri. Now it's time to get the speaker introduced. For that task, I would like to invite Vidya Jyoti, Professor Vajira Disanayake, Dean of the Faculty of Medicine of the University of Colombo. Over to you, Professor Disanayake.
Thank you very much. Good morning, everybody. It's indeed a pleasure to be jointly organizing this series of webinars in collaboration with the National Science Foundation. The idea of the webinars came about during a visit of Dr. Chatura Gunasekara about 6 months ago, when we had the opportunity to discuss how we empower and equip the young up-and-coming researchers in Sri Lanka with cutting-edge knowledge and technologies. And that led to the development of plans. And given the role that AI is now playing in every aspect of science and technology and its application in the field of healthcare and medicine, we decided that we will have a series of webinars focusing on the application of AI in healthcare and how it is impacting healthcare. So today we have the first of these webinars on reshaping the landscape of healthcare and medicine, which is powered by large language models and generative AI. And our speaker is Dr. Chatura Gunasekara. Chatura is an alumnus of the University of Colombo. He graduated with BSc in computational physics from the university in 2010, I believe. And thereafter, he went over to the US, where he trained at the Michigan Tech University on computational sciences and obtained a PhD in computational sciences with a focus on computational biology, where they specialize in where he specialized in bioinformatics algorithms, machine learning, and software development. He's currently a bioinformatics scientist at Baylor College of Medicine. And his primary research today focuses on epigenetics, particularly understanding how genetic and environmental factors shape human health. Alongside this, Dr. Gunasekara is a strong interest for following cutting-edge advances in computational sciences, artificial intelligence, and exploring how these technologies can be applied to healthcare and medicine in advancing science. You would have those who follow technology would have heard a few recently, Bill Gates mentioning that when he was asked who will survive the AI revolution, his answer, there were three categories of professionals who will survive the AI revolution. One was those who are engaged in programming AI themselves, and others are those who are involved in biology. And so this series of webinars, basically, we are, catering to those who we believe will survive this AI revolution and take things to the forefront in the future. And if you are wondering what the third category Bill Gates picked up was, he picked up those in energy, in the energy sector, because matching the requirements of the energy sector, he believed require the human intelligence to be playing an active role. So without further ado, let me invite Chatura to talk to you on the topic, which is going to set the scene, not only for what is going his talk, but also for the series of talks that we will follow in the year to come. So today's talk on reshaping the landscape of healthcare and medicine with the power of LLMs and generative AI would set the scene for that, the long series that we plan to have in the future. And of course, we will also learn from Chatura of the work that he's doing, and that would create opportunities for the participants who are here today to reach out to Chatura and to also be able to collaborate with the work that he does, and hopefully we'll have an opportunity in the future to have the opportunity of meeting up once again with Chatura when he's in town. So with that, thank you very much, Chatura, for accepting the invitation. Of course, you have been a co-planner of this series, and so over to you to set the scene for the series of workshops that we plan to have. Thank you.
All right. Thank you, Professor Disanaika, for the kind introduction. So I will share my screen. Can you see my screen all right?
Yes, we can see.
All right. Okay, so welcome everyone. So I'm really excited to kick off this seminar series on AI in healthcare and medicine. And when we started planning this, my main goal was to simply to share what I have seen and been learning in this space, especially how these new AI developments are starting to impact healthcare. The background photo here is the where I work, Texas Medical Center. It's actually the largest medical center in the world. It's packed with hospitals and research institutes and everything in between. And little bit about me. My main research focus in computational epigenetics and machine learning, but over the last years, I want to develop more. I developed more interest in the AI space as well, with large language models and how AI impacts the healthcare in a broader scale. So in this first talk, I want to zoom out and give you a big picture view. So we will look at where things stand with AI in healthcare and what kind of problems it's been used to solve, and go through some of the examples and case studies. Hopefully this stage sets a stage for the rest of the series. So before going further, I wanted to get some kind of idea, how is the audience, what the background in the audience. So if you can just scan this QR code from your phone, or the phone, or you can enter this URL. I can put that in the chat as well. Then I can get some kind of idea of the background of everybody in the audience. Let me see, okay, I'll give you a second, and if you can see, okay, I'd see, we can share this. Okay, so we can see most of them are familiar with applications of AI, usually general purpose, summarizing, idea generation, translation, and literature reviews, analysis, in education, and some developed softwares, and some don't use. So that's all right. And yes. All right. Let's see one more time. Yes. So most of them use this technology to generate ideas, summarizations, translations, and literature reviews. Okay, so I will start with the broad introduction. Since this is the first talk of the series, I want to set the stage where we stand with AI. So first, I wanted to give you a broad overview of this field. So when we talk about AI today, we mostly talk about or jump straight to ChatGPT and other language models. But it's important to realize that LLMs are just the tip of the iceberg. At the top level, we have artificial intelligence. This is broad idea of building intelligent machines. Can be from autopilot systems to simple hospital diagnostic decision trees. And all that falls into this whole umbrella of artificial intelligence. And beneath that, there's machine learning. This is where things get more data-driven. So machine learning is about recognizing patterns in the data. So basically, you can say identifying risk factors based on like epigenetics or genetics and predicting disease risk. Those kind of things fall under machine learning. And deep learning is a subfield of machine learning, which is more geared toward analyzing images, text, and audio like unstructured data formats. It's also still a type of machine learning algorithm. And finally, we have at the narrowest point, we have large language models like ChatGPT, which focus specifically on understanding and generating human language. And that's where we focus today. And the best way to get an idea where we stand is to like look at the history of this technology development. So post World War II, there's information processing boom like in mainframe computers, and Turing test was actually 1950, like, and the term AI was coined in 1956, so way back. And along this timeline, you can see some of uh, the the developments happened also in the healthcare as well. So here it says mycin in 1972 is rule-based system, which is basically like you put everything known about certain like diseases and rules in the medical literature, and they like programmed hard-coded into the computers and then use that to make some decisions. That was 1972. And then these are something called AI winters, where didn't any kind of big improvement didn't happen in that time periods. And around 1980 to 1990s, there was big explosion of data with the introduction of internet, and also there's computing power uh, was developed around that time. So that's when the deep learning started to pick up. And then from then onwards, there were so many other applications in deep learning like Apple Siri, Amazon Alexa, and all that. And from that, around 2017 was this landmark paper called "Attention is All You Need" by Google was published. And from there onward, we know we have this ChatGPT right now. And along this line, you can see there's some AI applications as well developed, but those are mostly related to machine learning and rule-based systems. So when I was like trying to learn a little bit more about this 1972 mycin system, I found this paper which was published in like more than 50 years ago. So here basically trying to like amalgamate all the knowledge that has been accumulated in medicine up until this point in order to make a diagnostic with respect to a patient. Sounds relatively familiar with what we want to do these days, right? We have uh, ChatGPT, or we want to like let an advanced AI system do something like that. And they have been trying to do this system for a long time. But those systems were not completely obsolete. Like those are like used in even today many other disciplines as well, like banking, and finance and other mission critical areas. And this is referred to as an expert system. And I wanted to see if we can like represent what we have in this kind of rule-based system in like Python if we do this today. So I first so this is I'm working on colab.research.google.com. So this is a cloud computing environment provided by Google, and it's actually free of charge. And here I can give the rules. So these are like I use ChatGPT to come up with this rule. So some of them may be not correct exactly, but this is for a demonstration purpose. I thought like this is good enough. So these are like the rule-based system. So you have symptoms, fever, chills, low blood pressure, high blood pressure. And if these are the symptoms, this could be the pathogens that may be causing these symptoms. And if this is a pathogen, this is the treatment. So these are the rules. So you can imagine like you can put all thousands of rules like this that's known in the medical literature and trying to make a system out of this. This is very complex and it's very hard to maintain. So let's see how this works. So so you have rules here, and I run this, and I get to this point. So here I can select fever. Let's say I have fever, chills, and low blood pressure, and I can run the system, and it gives me the pathogen and the treatment. So that's basic based on these rules. And also I want to see if we can like have ChatGPT integrated into this, what will happen. To do that, I use this open API programming interface. So we can use open API programming interface in Python, and we have to give this API key, which is I have to pay a little bit to run this. So this is not does not come along with ChatGPT. It's separate from ChatGPT. So we can call the API, and let's see the prompt. So the prompt is a patient presents with these symptoms. The likely pathogen is whatever the pathogen that's selected from the rule, and the recommended antibiotic is whatever recommended by the rule. And explain this to a medical student, let's say. And this is the prompt. So that's why this prompt generate this kind of information. The patient in question is exhibiting symptoms such as fever, chills, and low blood pressure, which could indicate a severe infection known as sepsis, like that. So this is so we cannot even imagine doing something that like this in a 1972 mycin system. But with ChatGPT, we can like use our medical knowledge along with the power of large language models generating human-like language and make a coherent and correct response. Second, the good thing is that this is very flexible. Let's say if we want to explain this to a patient, we just need to change it here and run this. I will copy this. And this now, let's see. So this is one of the before, and let's see how the new output looks. So this is when you explain it to a medical student, or no, sorry, to a patient, It's maybe a little bit less technical, and so it's like easy to explain to a patient. So that's the flexibility of this large language models integrated programmatically to a medical system. So you can see like easily we can increase the intelligence of a normal software platform with few folds using this technology. Right. This go to the next step. So after like the rule-based systems, they were mostly machine learning systems. So machine learning systems we train based on the data. So the basic idea is we give a computer a large set of examples, and we call the training data. It learns the patterns from this data, and based on the pattern, we build a model. It can be a classification model or a regression model. And when we get new data points, we can do a prediction based on the model. And this has been very successful. And this, I found like, these are like the FDA approved. FDA is the US regulatory body for approving medical devices or medicines. And these are all machine learning based systems that is approved by FDA. So they are like working perfectly and they are tested rigorously. And that was in the machine learning era. So in the last couple of years, we have went from those predictive machine learning systems to creative or generative systems. And everything started in around 2014. So this is Ian Goodfellow is, I think he was a researcher in the Google DeepMind, and he proposed GANs. GANs are generative adversarial networks. So that's the breakthrough idea where two neural networks compete to generate images and other one critiquing them. And the first application of generative AI was in generating images. So this, you can see the progress from 2014, 2018, they have generated these images. These are non-existent people. So they are like generated these images out of their training data. And going from predictive to generative, then attention is all you need is the paper by Google Brain. So that's where this transformer architecture, that's the large language model or ChatGPT is based on, is published. So that was around 2017. And then we have ChatGPT, Gemini, Anthropic. Those are the main providers of these chatbots. All right, to summarize, we can see like what are the systems we have. So we have rule-based systems, which is training is done, is just hard coding the knowledge. And the machine learning systems, they learn from the data and mostly label data or supervised learning. And generative AI, we have the post or pre-training of the non-text data in the internet. And rule-based systems, you have input is structured data, and machine learning models also have structured data, and generative AI models have mostly unstructured or multimodal data. Multimodal means they are can be video or audio. And output of these rule-based systems are mostly deterministic. That is like for the same output, you get the same input, you get the same output. And for probability machine learning models, the output can be probabilistic, and for generative AI models, output is also probabilistic. And so these are like the main highlights of these three different genres we have. All right. So when we have ChatGPT, what does GPT actually mean? So GPT, we have generative and pre-trained transformer. And generative means like it works by predicting the next word. So it's actually, think about it, it seems pretty simple. And like how you can think like how predicting a next word can lead to this kind of like intelligent behavior. And all that is done by this pre-training. So building a language model is actually easy. So it's like done before. So you have tons of tricks in the are used to train the model, and using the model, you build a language model. From the language model, then you pre-train. So then you can use that trained model to answer certain question. And I have another demonstration. Let's see if we can run that one. So here I'm showing how this generative languages like have a generate a certain like word, next word prediction. So in here, I am showing, let's see. So basically what happens like this. So let's say we have a text like this. The cat likes to sleep in the, and the next word is predicted based on all the input that went into the model. And based on that, we get the highest likelihood word is the box out of this. And that's what ended up in here. And I actually wanted to see if they're actually true. And I found this program like which we can use to like get the output from the language models and see what are actually the probabilities of the these next words that are predicted. Let me see if I can run this. Okay, so let's see if we ask a question. Okay, so it generated output. So if you go all the way up, so this is the where I'm sending the request to GPT-4, and the output is the first word it generated has the highest probability is the hello, of course, because I asked like, hi, how are you? So the first most probable word is hello. So then there's an exclamation mark. Then I am just a computer program. So I don't have feelings. So that's how it generates like a word, one word at a time. And somehow it creates this whole experience, very like intelligent. Let's go back to my presentation. Okay, so pre-trained. And so when we talk about like training, like what are the data that you actually use to train this? So you can see here the data. So y-axis is how much data that actually used to train each of these models. And you can see like GPT-4, that's about like 1 terabyte of data. This is only the text data. So that's still a lot because when you think about 1 terabyte of text data, that's almost everything in the internet written in like in the written. So this does not include other models like video or audio. And the most recent models, I think, have even more, like close to 100 terabytes. Okay, so we are living through like a moment history where technology shifts affecting like every field at once. Like so AI is at the center of it. And you can see from these two Nobel Prizes. So the Nobel Prize in physics in 2024 was given to two AI researchers for their machine learning and artificial neural network. And Nobel Prize in chemistry was given to also AI researchers from Google DeepMind. And this is for the AlphaFold or the protein folding algorithm. All right, so that's like a long introduction for LLMs and generative AI. And next, let's go to the next section about like how LLMs are actually changing medicine. And over past couple of years, there has been like real explosion of high impact studies looking at how large language models can be used in clinical medicine. And here you can see straight away the performance of multimodal GPT-4V, which is a video model on USMLE. USMLE is like a certification exam. Every doctor has to do to like certify before they're going into practice. And also there's several other papers that discuss like how these large language models are used in clinical setting. And New England Journal of Medicine is like one of the top journals, and they have like now dedicated AI section in there, which publishes all these AI related papers. And this paper is particularly important. It uses using ChatGPT to facilitate truly informed medical consent. That means like we know like when we get some kind of legal document, when we go to some place like hospital, and sometimes we don't understand. So this technology can be used to like transfer that into like normal day-to-day language, so we can easily understand. And those kind of things are coming up right now. And in here it says toward conversational diagnostic AI. It's also from Google research. These papers are telling us something important. So LLMs are not just passing tests or generating answers anymore. They are starting to show up in real clinical applications. And so it's going to be even more stronger and faster adaptation in the coming years. And still, most of the data that's used to train GPTs are not used uh, uh, did not use medical data, because most of the medical data are like hosted in these proprietary databases. And in this paper, they used ChatGPT to generate drug candidates, and they evaluated whether they can be used to repurpose for Alzheimer's disease. To do that, they used ChatGPT and used that output on their proprietary data and see if those repurposed drugs have any the predicted drugs from ChatGPT have any efficacy in predicting treating Alzheimer's. And this is one of those applications. So these are like, it seems like very primitive, but they are like the low-hanging fruits that you can do with large language models we have access to. All right. So far we talk about other papers and everything, and I want to share some of the tools that we right now have access to as a science researchers or medical professionals. So this consensus is one of those applications. Let me see if I can share this. Okay, so here, so the good thing about this is like all the answers are generated based on PubMed and other trusted medical resources. So they're not just ChatGPT outputs, because we sometimes cannot trust ChatGPT outputs because they are not really trained on vetted medical literature. Let's say if we put some text in here. Yes, I think if we do this, is vitamin D effective in preventing respiratory infections? And if you search with this, you can say, yeah, it gives like a for an answer, it gives a yes, possibly, mixed, or no, and it's checking all the papers and give a percentage of, for the question, it's 40% yes and 20% possibly, 7 mixed. And also you can check all the references for all these answers that was generated. So this is a good tool for medical students or medical professionals who want to use this kind of generative AI technology. And also another thing is the open evidence. And open evidence also, here I already input this question. So here is very similar, and it is a paid system, but I think you can get like a certain number of queries you can do. And this is also similar to ChatGPT, but trained on medical literature specifically. And you can check the references and all other the information are true, or like you can verify them. All right. So the next thing I think AI will completely upend is the education. So you already know, you can like the things that we used to do, like writing essays and all those things, no longer no longer can be used as a measurement tool, because with these tools are publicly available for anyone. So the education going to be completely different going forward. And I want to show you, like, since this is like mostly targeting the medical community, so I want to share some of those tools that actually you can use to uh, like use in your day-to-day work. So another thing I found is, yeah, AI patient actor app. So this app actually like simulate how you like talk to a patient, like getting the symptoms and how to like interact with the patient. So this kind of thing couldn't exist few years ago. So this is very lifelike and can be used to in a medical education setting. All right, let's go to. All right. So with all these technologies, there's all and like algorithms and the system, there's always some risk and also ethics concerns are involved. So there'll be a separate section down in our series of talks. So I'm not going to go deep into it. I'm not an expert in this field anyway. So some of the things I found that are like very easy to explain is some of those biases in the training data can harm actually certain groups of people. So there's a paper published in Science, I think, yes. So this shows like this, some of the people uh, they looked at commercial algorithm used to identify patients with complex health needs and something that impacts millions of people. What they found was at the risk score, these black patients were actually sicker than white patients. So what did happen? The algorithm wasn't directly predicting the illness, it was predicting the healthcare cost. And because the historical and systemic inequalities, less money tend to be spent on care for black patients, like historic patients, and but where they are just as sick. So this is like highlighting some of those like biases that can end up in these systems, because these are trained systems based on the data available. And based on the availability of data, there can be biases that transferred into the systems we might even never know. And also another problem is called hallucination. So hallucination is when a model generates information that is factually incorrect and unverifiable, but it sounds very confident and fluent. And there's no way for us to figure it out. But there are uh, research being done on how to uh, catch hallucinations, even in this kind of ChatGPT, like black box language models, because we don't know what exactly goes on in ChatGPT because it's a proprietary system, not like open source language model. And there are research done on how to catch hallucinations, but with recent developments in the ChatGPT and other language models, this is getting far less. So this is, I think, being addressed by the providers of these models. All right, and so then there are the transparency issues and data privacy issues, because if you have to plug in your patient's data to a system, and that system is outside your organization, that there could be issues. So, but some of the healthcare institutes, they can get insulated ChatGPT or Microsoft Copilot systems that don't take their data to train their system again. So there's work around for those problems, but there could be this kind of ethics and risk in algorithmic healthcare. All right, now the future of healthcare with this AI technologies, where we are going. And I use ChatGPT to answer this question because still we don't know what's happening. So there's only many of the articles are published in news outlets, and they're not really verified. So I used ChatGPT Deep Research. So ChatGPT Deep Research is a tool provided in this ChatGPT tool, and it actually goes through all the website and news articles and blogs and everything, and combine everything and give me output of what people are speculating how this might change the healthcare in the future. And it's actually very reasonable answers, and you can see like patient outcome prediction, tailored treatment plans, medical imaging enhancements, and like such as like that. And so here I give a little bit more detail, like uh, the explosive growth in AI capabilities meet urgent healthcare needs. So like there's so much a burnout of healthcare staff because of the workload, and AI can help in these situations. And uh, LLMs show near expert clinical knowledge and passing medical exam. So that means there is some use to this that can be incorporated into the medical care. All right. And one of the another easy implementation of these LLMs will be, I think, administrative and patient-facing benefits like coding, billing, and those prior authorization processes. Those things can be automated and can be benefited by the LLM systems. All right. So as we have seen, the application of generative AI in healthcare are really impressive, but truly we are only scratching the surface. This is just starting. We are standing at the very beginning of like a transformation that will shape how we diagnose, treat, and engage with the patients because of the increased uh, intelligence of these software systems are that going to be built in the medical and healthcare setting. And so I genuinely believe this is like the best time to be working in this healthcare. And I hope you learned something from what I shared, and hope to continue in the series and share what I learned in the next coming sessions. Right. Thank you.
Yeah, thank you, Dr. Chatra Gunasekara. And I think now Dr. Professor Vajra Disanayaka will be moderating the Q&A.
Thank you, Chatra. I think you've given a kind of an insightful overview of how AI can, transform healthcare. Now, going forward, what do you think? What is the advice that you have for those who are, I'm sure there are a lot of young people listening to this talk. How, a lot of people would be kind of users of technology rather than creators of technology, right? So,
Right.
how do you make that transformation? Because I think that is what is required in our setting. We tend to use a lot of technology that is developed elsewhere, and then we become the consumers rather than the creators. So how do we, as a scientific community in Sri Lanka, make that transition from being users to creators of technology?
Yes. So, so when we think about this technology, so this is so this technology can be used to like automate things that we feel like burden to our main task. Like for example, a research scientist. So this cannot be used to like create new knowledge, right? So this can be used to like automate some of the tasks that we think are taking our time. So in the future, I think this will be directly integrated into like email system. For example, when you write an email, like you have to like think a lot of time, like how to respond to email in a proper way. And I think I have seen like even the Microsoft Outlook, it just creates the email for you, and you just need to verify that it's done, like it's good enough. So those kind of things, the things that we don't need to pay our attention, like which is our like the most important part of our life, it is like our attention can be directed to that's like more important questions. Uh, so the the so there's no area that AI will not improve, because it can basically do anything if we think about it. So yeah, so I think for right now, at this like for the next maybe like a decade or so, we will be automating many of the tasks that we do that we don't need to our focus. Yes.
Okay, thank you. Chatura, I was, as all of us appreciate one of the points that you were making, that is like, writing big essays and so on is kind of going to be a thing of the past, because you can, get AI to evaluate documents and prepare synthesizes in different ways and so on. So if you can enlighten us from the point of view of what you are transitioning that to, for example, in the context of the student examinations and others as well. Um, at Baylor, what are the newer kind of ways in which you are using technology for education?
So, in Baylor, I am not directly in the education or directly teaching uh, duties. So my work is mainly in research, but uh, I have seen most of the use cases of ChatGPT are using these custom GPTs. That means we incorporate some of your non-medical knowledge and create your own uh, ChatGPT basically. That means it has your background, so the answers that you get are catered to your own uh, experience. So that's one thing I have seen in used in the college actually. And other than that, so there's most of the applications are in coding. Like for example, like you can you don't need to Google anymore. So you can use coding is mostly done through I would say 70% of the coding now it's done with using a system like this. But you have to in this you have to verify, and because it can generate code which is not what you intended for. So that's verification is your responsibility. And yeah, I think that's one area that's this is used most. And also summarizing and explaining it to different audience, different concept. So that's also one other area that's used.
Okay, thank you. And of course, I'm waiting for questions to be posted by the participants on the chat, and at that, so um, uh, while I get questions, just have another question for you, Chatura. Now, you came from a science background, not necessarily biology background, but you are now kind of in the intersection of both. So for new graduate who is coming out, let's say from computer sciences or some such field like that, what do you think? What are the learning experiences that they should look or learning opportunities or areas of learning that they should be focusing on to kind of come to speed, as it were, to work in the field of biology as a computational biologist?
Uh, yes. So I would say start directly with the data, and go work backward. And you don't have to start, because if you start to want to learn every fundamental biological concept and then try to go to the data analysis part, that will take way too much time, and you will learn things you don't need to do the work you are going to do. So going backward actually helped me a lot, starting with the data, and because that's where in the end you'll be working on you are working in your trench is the data sets. So for incoming, I guess, bioinformatics person who's from a different field, the best way is to like play with the data and use the tools and see how the output changed when you change the input, and then figure out why it works. So that way was the fastest ways to get up to speed. And yeah, that's my advice.
Okay. There is a question in the chat. Please clarify whether deep research of either ChatGPT or Gemini has access to medical databases, tools like consensus.
Yes, so I think some of the free medical literature is accessible to the ChatGPT or Gemini, because ChatGPT Gemini is mostly trained on something called Common Crawl. Common Crawl is just the open internet data. And some of these older papers are not behind any paywall. So they are just out in the open. So it can be traversed by these algorithms. And most of the new papers, most recent medical literature may not be in the training data for ChatGPT or Gemini. And consensus is like using this paywalled literature in their training data. So yes, yeah, the answer to the question is, please verify. Yeah, so that's it is. So it's not available. Yeah.
All right. Then there's also a question on whether there is guidelines to govern AI in use in healthcare in Sri Lanka. I can provide an answer to that. No, there are no such guidelines. But I wonder whether Chatura has some insights as to, for example, how the FDA looks at the application of AI, because they will be the ones who regulate the deployment of technology. Any thoughts on how FDA looks?
Yeah, I think the best way to like get an idea for that is how FDA looked at those machine learning based systems. So it took about like 10 years for actually most of those machine learning system to like approved. When you look at those like timeline of history, most of those like algorithms developed like at least 10 years prior to they actually apply. So there's like a lot of verification and confirmations. Uh, and so for these large language models, I think it will be even more difficult, because most of these models are provided by private companies. They don't want FDA to look into those things, because they are like hidden. So it will be difficult, but I think like some of those are Microsoft and Google, they have like partnered with these medical databases, large medical databases, and so they have access to that knowledge, which other companies don't. So I think through that path, they will be uh, like validated through FDA at some point, but it will be like little bit different from the other point, because these are not deterministic systems. So like very like random. Yeah. I can't hear you.
There is another question, probably from someone who knows you, Manjula. He has Vikramasinghe, who is asking, thank you for your interesting and insightful session. For research purposes, which AI model would you recommend among the following or any other? OpenAI's GPT-4, ChatGPT, Google Gemini, formerly Bard, and Cloud or Anthropic.
Cloud.
Cloud.
Yeah.
Yeah, Cloud by Anthropic. Yes.
Yes. I think for what I used, so Claude I use mostly for like programming. It's like so they are like very specialized in their model trained on the code. So like developing like generating code, I think I would use Claude. For OpenAI and Gemini are, I think, the best models for research purposes. And there's like a difference between the free version and the paid version. Of course, the free version is like much more limited. So I used paid version. So and yeah, there's a limitation in that difference in the free and paid as well. So and Google Gemini Google Gemini free version may be better than ChatGPT's free version because they have more resources allocated to that than that. So I'm not sure which is better in that too because I mainly use ChatGPT or GPT for the paid version. Yeah.
Thank you. So those are all the questions in the chat. And so Chatura, I think in your presentation, you set the scene for the future talks to come. And so I think the participants would have seen the style in which we would like to conduct these series of webinar workshops, as it were. We want it to be very educational and also, give it a kind of a practical sense rather than somebody coming and giving a talk and going away. We want it to be a little bit more interactive also and a little educational, like the way Chatura did it, so that even for a beginner, it makes sense and you can see and appreciate some entry points. So Chatura, thank you very much for that very educational experience to all the participants. We all learned a lot from that, and we look forward from my side, from the Faculty of Medicine, our Center for Genetics and Genomics, which is located in a bigger department of anatomy, genetics, and biomedical informatics, where we are also working on biomedical and health informatics. We look forward to collaborating with the NSF in the series of a symposia that we plan to organize. We probably every other month we will be having a symposium, and we will really pitch it at the level that we did it today, so that we make sure that it contributes to capacity development in the country, and more of the younger biologists, computational scientists, and those interested in the field will be able to take on to it and go forward. So please feel free to reach out to all of us, and please feel free also to reach out to both myself and Chatura. I will put my my email address on the chat, and Chatura can also put it there, so that we will try to cater this series of webinars to cater to your educational needs, so that it leads to capacity development in the country, and that is our intention. So with that, Chatura, would you also like to share? I have put my email on the chat. Yeah.
I just did. Yeah.
Okay.
Right.
Okay. Over to you, Pilina.
Yeah. Right. Thank you, sir. Thank you very much for our speaker and to Professor Vajra Disanayake. So, in order to wind up this session, let me briefly present the essence. I guess we came across about the re-engineering of healthcare through AI and the potential to revolutionize the patient care and improve outcomes. And by leveraging the power of data and AI algorithms, we can provide a better service, personalized solutions. However, it is crucial to address the challenges and ethical considerations associated with these technologies and ensure the responsible and equitable implementation. So I think we would come up with new topics to address this whole team. And at this point, I wish to thank the key personnel engaged with this webinar as well. My special thanks goes to our speaker today, Dr. Chatura Gunasekara, Bioinformatics Programmer Analyst at the Baylor College of Medicine in USA, who shared his valuable knowledge voluntarily, dedicating his time and effort to make this session a success. And he joined, for your information, he joined through our Global Digital Platform Initiative, where expatriate Sri Lankan scientists and professionals contribute to the development of S&T sector through the National Science Foundation's contribution. Then I would like to also thank you very much, Professor Vajra Disanayake, sir, Dean of the Faculty of Medicine, University of Colombo, for joining hands with us for this series of webinars under the theme on AI in healthcare. And also to the technical support team from both the NSF and the Faculty of Medicine, University of Colombo, for the timely technical facilitation. Also, to the Director General and the Additional Director of the NSF for all the kind guidance and support. And last but not least, we are much thankful to the participants of this webinar for the cooperation and insightful discussion. Thank you very much and have a good day. Thanks.
Right. Thank you very much. Right.
Thank you, Chatura. Thank you to all.
Thank you. Thank you.
Right. Bye.
Bye.
Recording stop.